What's up, everyone? Dr. Eric Jackson here. It is the fourth of our four-part installment on pH and your oral health. As a quick recap, the first part of the series was kind of an introduction to pH, recap from your elementary school days. We went over some of the more common fads: apple cider vinegar, heavily lemoned water. We talked about enamel and dentin breakdown at 5.5 pH and 6.5 pH. And we talked a little bit about saliva. In the second installment, we talked a little bit about soda, the sugar, regular soda versus diet soda, and misconceptions with Gatorade. Unfortunately, much like with the vinegar and lemon water, Gatorade is not a health item. It has certain repercussions if used incorrectly. And we talked about fruit juice as well. We want to make sure that we're using that correctly and doling out the appropriate amounts based on the 2017 update from the American Academy of Pediatrics. In the third video installment, we talked a little bit more about water specifically, subdividing it into certain categories rather. We talked a little bit about carbonated water, LaCroix, bubbly, how they should not be your primary source of hydration. Good old-fashioned, inexpensive tap water is still the number one there. We finally finished up with how bottled water, you would think, oh, that's a very safe option. Well, it can be, but it isn't always. There are some bottled waters that are very prevalent in every supermarket in America that are surprisingly pH acidic. We talked about this table, which is fantastic as far as a pH comparison values. It's from the June 2015 Journal of Dental Hygiene. And I really like it because it brings everything from a low pH of 5.16, as you can see in the top left corner there, all the way up the pH ladder to 10.38, which is a alkaline water, which is what I'd like to start with talking about today. So this is a relatively new classification or new category of water, right? And it's fledgling, so not a ton is known about it. Like with all things, time will tell. There need to do some studies. They need to be used by people because we don't want to be caught up in marketing, right? We want to be caught up in science. And some manufacturers are touting alkaline water as miracle cure, and most miracle cures simply aren't. It's depending on what you're trying to achieve with it. Now, I like alkaline water philosophically because we've been talking all about the negative pitfalls of acid this and acid that, and here we are with a slightly basic water that, if you remember your chemistry, acid cancels base, and when you have you're drinking basic alkaline water, I think there's a pretty logical explanation that it's going to cancel out some of the acidity in your mouth. So Essentia is probably one of the biggest examples that I've seen coming through the office and at the supermarkets and whatnot. I'm interested in hearing more about the scientific research behind alkaline water with regards to oral health. And I'm sure with time that will come out. The American Dental Association and other organizations like it are always doing excellent research on topics such as these, fledgling new technology, fledgling new trends. So I look forward to that, and I think that it could be quite promising with respect to the acid base values. So let's dive into these alkaline waters a little bit. The first thing, we always have to make sure we don't get caught up in marketing. I know there are several, more than several, frankly, places on the internet that really tout the medical benefits of alkaline water. Everything from improved exercise recovery to cancer fighting abilities. Again, much like with the apple cider vinegar and the lemon water, I'm not a medical doctor. I'm not a physiologist, but I am a dentist. And I know that certain things matter with regards to pH and oral health. So putting basic or alkaline water in your mouth is far better than drinking vinegar, for example. And so I'm interested in knowing more about this because it goes along the same lines as putting baking soda in toothpaste. Baking soda is also an alkaline material, and so it's a pH neutralizer for all the acids that are being produced by the bacteria. So I look forward to the potential research benefits to this. I'm sure there's plenty of research being done. It takes time though, and so we'll wait. We'll see. We just don't want to get caught up in marketing. One final tidbit as well. I want to mention for swimmers especially, make sure that you practice fantastic oral hygiene when you're actively swimming. I've had a lot of patients who are on swim teams, especially in high school, but it could be any time during your childhood swim career. Logically, people know that you do the pH testing of the water in the pool and whatnot. And if that's off and you're spending hours and hours swimming with your mouth open in this liquid that is, if it's not pH balanced properly, that can have a significant effect on your teeth. I've seen swimmers that are fine and all of a sudden they get to a competitive point in their career where they start really putting extra hours in the pool. And if that pool isn't tweaked just right, well, they develop cavities. And so when it comes down to it, I always recommend a little extra fluoride supplementation, over-the-counter Act or Listerine Total Care, especially good brushing, of course. Brushing, flossing, you can never go wrong with that. But now, just like with swimming pools, hot tubs also must be pH balanced and appropriately chemicaled, if you will, with the chlorine. Chlorine is a very powerful additive. I'll put a quick link to the Colgate company website. It's got an excellent article on the effects of chlorine on your teeth. And it goes hand in hand with the discussion I'm having right now with the potential dangers of unbalanced water in the swimming pool and unbalanced water in your hot tub. So all in all, how do I wrap this up? It's the fourth part of the installment. High points, right? Let's hit the high points. Don't get caught up in marketing. Don't get caught up in fads, right? Be careful of fads that tout their miracle cures that don't have any real scientific references behind them. Now, with that said, you're going to find some miracle cures that do. Make sure you read those studies. Make sure you know who's funding them and whatnot. Dive into the actual reasoning behind it. But even if you don't want to, remember this. Tap water is the way to go. Tap water is pH neutral. Tap water is effective, it's efficient, and it's economical, right? Beware of the carbonations, beware of all the sports drinks and sports waters. Keep your eyes open for more alkaline waters, that research that comes out a little bit further in the future. I bet you that's going to be pretty interesting. Maybe it ends up positive, maybe it doesn't, but only time will tell. I appreciate you listening to everything here in this 4-part series. I hope it kind of stimulated a little bit of discussion and some thoughts in your head. If you have any questions, please email me, message me in the comments below, however you see fit. And if you like this kind of content, let me know too. We'll see if we can do more multi-part series and kind of digestible bits. So in the meantime, until the next video, I hope you have a great rest of your day, and I'll talk to you then. Bye-bye now.